The Newsday continues here on One News Now. I'm Charles Lejano. More frontline healthcare workers reported mild side effects after receiving Sinovac shots. But the health department says these side effects are manageable and there's absolutely nothing to worry about. Jenny Dongon with the report.
Dr. Christopher De Los Santos was first in line to get vaccinated at the Dr. Jose Rodriguez Memorial Center in Tala, Caloocan City. He developed a headache after the shot, but he said it's nothing out of the ordinary.
Ang tumatakbo lang sa isip ko noon, it can be just part of a vaccine experience.
Respiratory therapist Meryl Gasang also experienced pain in her arms and blurry eyesight for a few hours after getting the job. She says the effects are tolerable.
Ang important kasi ay mavaksinan ka. It's better na maging protected ka kaysa naman sa wala talaga.
But for Samuel Sumila, the hospital's chief nurse, he even had a good night's sleep after getting vaccinated.
Malaking bagay po yun na kahit papano, meron na po magiging proteksyon kahit papano po, no? So yun po yung isa sa mga antagal naming hinintay.
The DOH only tallied 13 cases of adverse effects. Most of these are minor, like rashes.
Wala sa kanilang na-admit, lahat sila ay inobserbahan, minanage, at after a while, they were all sent home.
Symbolic vaccinations continued throughout the metro. Over at Santa Ana Hospital in Manila, Vice Mayor Dr. Hani Lacuna got her job as a health worker. Mayor Isko Moreno has yet to receive his since he is not considered a priority.
Because of what transpired yesterday, marami na-inspire na mga doktor at nurses. So, umakyat ng 19 yung aming nagparehistro.
In Pasig City, more medical frontliners have also started to come in for vaccination. Pasig City Mayor Vico Soto said vaccination is voluntary, but he urged the public to trust the available vaccines. FDA Director General Eric Domingo also hopes the symbolic vaccination involving health workers and some top government officials will serve as proof of vaccine safety.
When we say we know it's safe, that we mean it, and that we will not allow anything to be used on them that we will not take ourselves.
Surveillance teams of different hospitals will monitor vaccinated individuals within 2 weeks before they receive a second dose of Sinovac. For News 5, Jenny Dongon, We Are One News.
PGH Director Dr. Gap Legaspi claims that hesitancy to receive Sinovac shots stems from non-scientific issues. In an interview with One News' The Chiefs, Legaspi said issues related to China are among the reasons why many PGH workers remain unwilling to get vaccinated with Sinovac. Recall that Legaspi was among the first to get publicly vaccinated against COVID-19 in the Philippines.
My assessment, it's not anymore the vaccine, but where it came from, how it's getting here, those issues. There's no clarity how we even got this deal. So those are the non-scientific part of this vaccine actually.
But for the president of the Employees Association of the Lung Center of the Philippines, the mere fact that Sinovac came from the country where COVID-19 originated is enough reason to think twice before getting vaccinated with the shot. Speaking with Radio 5's Ted Filon, Lung Center nursing attendant Eleazar Sobinsky said that the Lung Center's employees also doubt that the Sinovac shot can protect them from the virus, especially when handling COVID-19 patients.
Una sir, galing ng China yun. Kasi ang aming kaisipan, saan parang galing yung COVID-19, di ba sa China? Tapos sila rin ang gagawa ng gamot. Ikalawa, masyado pong mababa kasi yung efficacy rate niya.
Symptoms of high blood pressure is normal for people who are getting COVID-19 shots. That's according to infectious disease expert Dr. Anna Ong Lim. In an interview with 1PH sa Totoo Lang, she said this may be attributed to the anxiety felt by health workers prior to vaccination. She added that people are examined before being inoculated to prevent any complications.
Siyempre, natural kung natatakot ka, kinakabahan ka, pwedeng tumaas ang blood pressure mo, pwedeng manlamig yung mga palad mo, no? That's expected. If the person is exhibiting abnormal vital signs, we have them rest a bit before we proceed with the vaccination.
Meanwhile, infectious disease expert Dr. Edsel Salvania discussed possible side effects of Sinovac in an interview with Ted Filon at DJ Chacha sa Radyo 5. He said soreness of the arms is normal after vaccination and so is not feeling any side effects at all. He notes that some people are just tolerant to the side effects, but that doesn't mean that the vaccine isn't working.
Doon sa pag-aaral naman, mukhang wala naman naging safety signal sa mga allergies. Of course, sumasakit talaga yung arm ng mga tao. In fact, ang sinasabi nga ng mga tao is yung Sinovac, dahil wala siya yung tinatawag na PEG or polysorbate, unlike some of the other vaccines, less allergenic siya. Ang risk naman dito, napakaliit po dahil alam naman natin dumaan sa phase 3 clinical trials, safe and effective naman po ito. Pero yun pa rin yung risk na kung magkaroon ka ng allergy, magkaroon ng adverse event. Now, yung benefit is protektado ka against COVID-19 at pinaka-importante po, mukhang mataas talaga yung efficacy niya against severe disease.
We'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Charles Lejano. A PDEA agent has told News 5 his version of the fatal shootout between the drug agency and the police force in Quezon City last week. He says what happened was an overkill on the part of the police. Gary De Leon with his exclusive report.
In this CCTV footage from February 24, Quezon City police are seen firing shots against PDEA agents inside this vehicle. A drug enforcer agent, whom we call Tonyo, exclusively tells News 5 it's possible that their asset, called Alpha, was a target of the cops. This informant was with them, carrying the budal money.
Nung nakipag-usap ang Alpha doon, na sinabi nila na dala namin ng pera na pambayad.
But instead of Alpha, it was PDEA agent Ranking Gano, who was fatally shot.
Dadalhin dapat sa paggamutan. Yung nga lang, hindi na kami naka-arrest at pinaputukan na kasi ng tropa ng mga pulis.
After the gunfire, the cops' target PDEA asset was found inside the restroom of the fast food chain. But it was too late as he was also dead.
Ang dating kasi parang agaw parang huli na pang gusto nila tapos papatayin yung Alpha, papalabasin na ng laban. Ang di nila alam na may mga tropa tayong kasama.
Tonyo questions. Why was their asset being targeted by the police? The police then ordered the PDEA agents to lie face down on the gutter.
Ang ginawa, binugbog sila ng mga pulis na lumisponde. Kaya kung makikita mo itsura nila, makaawa ka.
He insists that the cops knew they were PDEA agents because of their uniforms. A cell phone video also showed that the cops were shouting that the agents are their enemies. For PDEA, this was an overkill on the part of the QCPD.
Pera kasi yan napakalaking pera.
PDEA Chief Wilkins Villanueva is challenging the QCPD to release evidence that their agents started the gunfight.
Magpalabas kayo ng ebidensya na CCTV na nagbenta ang PDEA at kayo ang bumili. Dung kaso na yon. I will resign immediately.
The NBI said the evidence they currently have is not enough. NBI Deputy Director Ferdinand Labin said they are now inspecting turnover weapons and mobile phones.
Dapat may corroborating evidence doon. Dapat merong supporting evidence na magsasabi. Because if you look at the coordinations, kung parehong by bust ang coordination, why did it happen?
The budal money and the bait illegal drugs have yet to be turned over. Reporting for News 5, I'm Gary De Leon. We are One News.
The global tally of new COVID-19 infections rose for the first time in 7 weeks. The WHO reports that over 2.6 million new cases were reported last week. That is a 7% increase compared to the previous week, and the slight uptick in global cases was mainly driven by increases in the Eastern Mediterranean and Southeast Asia. WHO Director General Tedros Ghebreyesus says the rise in cases was disappointing but not surprising. He is urging countries not to abandon anti-COVID measures, noting that it's still too early to rely solely on vaccination programs.
Vaccines will help to save lives, but if countries rely solely on vaccines, they are making a mistake. Basic public health measures remain the foundation of the response.
As of 7:30 this morning, total COVID-19 cases globally stands at almost 115 million, according to data from Johns Hopkins University. The global death toll has climbed to over 2.5 million, while almost 65 million have recovered from the disease all around the world. Sinovac shots may be effective even against other variants of COVID-19. In an interview with The Big Story, infectious disease expert Dr. Edsel Salvaña says this is due to Sinovac being a whole inactivated vaccine. He also pointed out a study in Brazil where Sinovac performed well against several variants. He also emphasized that whole virus vaccines achieve better results against variants in a laboratory setting.
For Sinovac, actually, serendipitously, since it's a whole inactivated vaccine, it seems to create a more diverse antibody and cell-mediated immunity response. And so the preliminary studies by Sinovac and in Brazil show that it seems to work pretty well against the different variants. So of all the vaccines, this might actually be the one that's good for different kinds of variants. And so we'll see. Theoretically, we know that the whole virus vaccines produce a more robust immunity and are more resistant to variants.
And those are the top stories of the hour. Join us later at 1 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Charles Lejano. We are One News.